Is your baby crying too much? It's a question that often keeps new parents awake at night. Crying is a baby's way of communicating, and it's perfectly normal for infants to cry 1 to 3 hours a day. They cry when they're hungry, tired, lonely, or in pain. They may even have a fussy period in the evening. But when a baby cries excessively, it could be a sign of something more serious. So, what could cause excessive crying? There's a list of possibilities. It could be boredom or loneliness. Maybe your baby has colic or discomfort from a wet diaper, or perhaps they're cold. Hunger or thirst can also make a baby cry, as can illness or infection. Other causes might be normal muscle jerks and twitches that disturb their sleep, pain, or teething. Now, how can you handle these situations at home? If your baby seems constantly hungry despite short, frequent feedings, it's a good idea to talk to your healthcare provider about normal growth and feeding times. If boredom or loneliness is the issue, touch, hold, and talk to your baby more. Place them within sight and give them baby-safe toys to play with. If the excessive crying is due to sleep disturbance, try wrapping your baby firmly in a blanket before putting them to bed. If the room temperature seems to be the issue, dress your baby warmly or adjust the temperature. Always check for possible causes of pain or discomfort. Look for loose diaper pins or loose threads that might have wrapped around their fingers or toes. Diaper rashes can also cause discomfort. Take your baby's temperature to check for fever and look for any injuries, especially on their fingers, toes, and genitalia. However, it's important to know when to seek professional help. If your baby's excessive crying remains unexplained and doesn't subside in a day despite your attempts at home treatment, it's time to contact your child's healthcare provider. Also, if your baby shows other symptoms, such as fever, along with excessive crying, don't hesitate to seek medical help. Remember, every baby is unique, and what works for one might not work for another. Patience and understanding are key in figuring out why your baby might be crying excessively and how to soothe them.